Okay, morning. Here we are, Monday morning. We're opening the clinic officially today for our first full hours. I'm going to walk you through the clinic areas where we treat patients, and I'm going to be very quick because we have a lineup of patients waiting already. This is our screening area. Here we're going to ask patients about their COVID symptoms. It's our priority, obviously, so that we can reduce the risk of transmission. We have two areas though, so it doesn't mean if you do have COVID symptoms that you can't get medical treatment, but just that we will segregate the patients and make sure that we're keeping everyone safe. So we are going to walk through the non-symptomatic side today, but just keep in mind they're equal and identical. So follow me this way. We're going to move to the first tent. In this tent is where we'll do triage. So a quick patient history to find out what they're presenting to the clinic today for, and then we can direct them to the appropriate services that we provide. Here's where triage takes place. There's doctors and nurses today, all of them local, and they'll do vital signs and, as I mentioned, take a history and then decide where the patients go through there. The second section of this tent has been sort of separated just to allow us to provide urgent treatment. If anyone comes in and the needs that they have can't wait, we can do some stabilization here and urgent care, sorry. As we exit this tent, the tent here on our left is PSS, so psychosocial support. And this may be an area that we refer a patient for treatment. Not all of the patients who come through need medical attention. We'll keep going to our consult tent. This is where the patients may, if all they needed was a prescription and then discharge, actually may wait for pharmacy here in this area. But this here is our consultation and observation tent. This is Jen. She's one of our nurses from Canada.
Hi! So in the consultation or treatment area here, we are all set up to see people who need IV treatments. We can do wound care, we can give them sutures. So anything basic that a clinic here would have already done for people. We have two set up exactly the same. So one is for more of an isolation, and then this one is for people who have screened negative to not have any symptoms of COVID. Hello.
Hello.
Okay, we'll keep going through. This is Dr. Pat, also from Canada. This second area of this first tent is set up just so that we can treat women a little more privately if they have any sort of gynecological or obstetrical issues. Just to allow us a little bit of privacy, we have some separation established there. Patient washrooms are here. This would be the patient exit as well. So they would exit here, attend the pharmacy if they needed any prescriptions filled, the exit pharmacy, and then exit this way. And then here is our warehouse on the right-hand side where we keep all of our supplies.
Hello.
Hi, this is Alexis. He's our pharmacist from Canada.
So my name is Alexis. I'm the pharmacist here. We are in front of the medical store tent. Everything that is medical supply is stored here. We handle all the requests from every team member to be sure they have everything to work. If there's medication requests, we try to do it at the exit pharmacy, which is at another place. This is more an office where we keep track of everything that we have.
Thank you. Awesome. One last area I'd like to show you is the tent that we use for staff who arrive for work in the day when they need to come in and don their proper protective equipment before they head into the area where they're going to work. That happens here in this tent. Hello.
Hello.
This is Candy. Candy is our infection prevention and control expert from Canada.
So this tent, as you see, is where people will grab their PPE before they go into the patient area. So this is will be set up better to be the donning area. And we also have signs here with the map to show people how the area is delineated and what type of equipment they'll need to use.
Okay.
So that's our emergency clinic in a nutshell. Thanks for taking the time to see what we do here.